Fast Facts: Understanding Overactive Bladder, OAB, and Urgency as the Core Symptom. Today, you will learn the physiology of bladder control, the definition of overactive bladder, OAB, the risk factors for OAB. In healthy conditions, bladder function is largely controlled by the sympathetic and parasympathetic nervous system. The bladder storage phase involves sympathetic innervation. Norepinephrine release activates beta-3 adrenergic receptors in the bladder. This stimulation causes the detrusor muscle to relax, resulting in increased bladder capacity. In this phase, the internal and external sphincters are contracted to prevent the passage of urine. The bladder voiding phase involves parasympathetic innervation. Acetylcholine is released and activates mainly M3 and also M2 muscarinic receptors, thereby stimulating detrusor muscle contraction. In this phase, the internal and external sphincters are relaxed to allow the passage of urine. The etiology of OAB is not well known, but in most cases, symptoms are suggestive of detrusor overactivity. In a healthy bladder, the detrusor muscles contract when the bladder is full, allowing for voiding to occur. In an overactive bladder, the detrusor muscle contractions can occur abnormally when the bladder is not near or at full capacity, as shown in the right image. OAB is a syndrome defined by the presence of 4 key symptoms, with urgency being the core driving symptom. According to the International Continence Society, OAB is defined as urinary urgency, which is usually accompanied by increased daytime frequency, and/or nocturia, with or without urinary incontinence, in the absence of urinary tract infection, UTI, or other detectable disease. Although urgency is the hallmark symptom, only 16% of men and 11% of women have urgency as their only symptom. Although not all cases of OAB include urinary incontinence, and not all cases of urinary incontinence are associated with OAB, there is a high degree of overlap between the two urologic conditions. There are 5 types of chronic urinary incontinence: stress, urge, mixed, overflow, and functional. Urge and stress incontinence are the most common. In addition, OAB symptoms of urgency may present without incontinence, which is also known as dry OAB. OAB is common in both men and women, but predictors for OAB vary by sex. The OAB poll study, which was conducted in 10,000 U.S. participants ages 18 to 70, found the following predictors of OAB. Predictors of OAB specific to men: hypertension, heart disease, BPH, mobility limitations, and prostatitis. Predictors of OAB specific to women: education, IBS, sleep apnea, and BMI. Predictors of OAB observed for both men and women: increasing age, African American and Hispanic racial ethnic group, smoking, arthritis, depression, recurrent UTIs, neurological conditions. Summary: the sympathetic nervous system is mainly involved in bladder storage, while the parasympathetic nervous system is involved in voiding. OAB is a syndrome with urgency as the core symptom. OAB and other types of UI can overlap, although their pathophysiology is different. OAB is common in both men and women, though predictors may vary. Are you asking your patients about their urgency symptoms?